The epidural button. What is it for and when to use it? Back in the day when labor epidurals were invented, medication had to be given by hand through the epidural catheter by a doctor every time a dose of medication started to wear off, which you can imagine is not ideal for a doctor or a patient. Then the automated epidural pump was invented. The pump could continuously give medication through the epidural catheter. The problem was that if the pump was set to give too low of a dose, patients were still having to ask doctors to come back to give extra doses. But if the pump was set to give doses on the higher side, many patients would become number than they really wanted to be or needed to be. With the button, we can reduce the amount of medication that is automatically given through the pump and then allow the patient to add more only if they need it without having to ask anyone. This is called patient-controlled epidural analgesia. It is the anesthesiologist's job to make sure that the patient is comfortable after an epidural is put in before walking away to let the pump do its job to maintain that comfort. The button should be used if at some point later on in labor that pain starts to return. The epidural pumps do have limits as far as how many times that button can actually be used. And it takes time after that button is pressed for the medication to start to work. So you got to give it 10-15 minutes to decide if it's helping. If pressing the button doesn't seem to help, never hesitate to call back the anesthesiologist so that they can assess the situation or possibly give medication that's stronger than what is in the pump than what you would get by just pressing that epidural button to see if that can get you to where you need to be.